So I will get a Botox today under Dr. Mark Gomez. The reason why is because I have a problem with my TMJ. So the muscle of mastication here, here and here sa masseter ko, we're gonna put some Botox. Ang reason natin dito is to be able to get rid of the strong force coming from these particular muscles. Nagkakaroon na kasi ako ng TMJ problem. So, dito, sa part na to, medyo nangangalay na siya. So, there are a lot of techniques intraorally. We use a splint, night guard to prevent from grinding and to prevent from further damage of the teeth and soft supporting structures. But one of the best treatment options for this kind of problem is Botox. Why? Because yun nga, it will release the tension and hopefully this would really give me the quality of life that I've been wanting for so long. So Dr. Mark is trained to do Botox here in the Philippines, and me as well. I did the training in Germany and Austria for the Botox treatment. So it's not as like very complex as long as we know the anatomy and the vital points, so we can do this. And dentists are actually allowed to do this type of treatment here in the Philippines. So I'm so excited.
Ayun na siya. Patient po today ngayon si Dr. Jonas. Okay. So si Dr. Helen mag-a-assist. Ayan. So mag-observe siya. Si Dr. Mark, kilala na natin siya. Our implantologist. Bakit siya ka umuho?
So one of the treatment options for like this kind of problem in mga TMJ is like yung mga full mouth reconstruction, equilibration, orthodontic treatment. A lot of options naman. But I did braces before, and then kailangan siyang like probably onlay full mouth reconstruction just to make sure that everything should be equally distributed, but it's gonna be very technique sensitive. So I would, in my case, I would want an easy way out, which is Botox. Kasi sometimes kahit nag-FMR ka na, full mouth reconstruction, if you have a strong muscle, kailangan talaga ng ganito. It's myofunctional yan eh. So we have to train the muscle, and sometimes it requires a lot. There are also like this one, Botox, which is very effective, and it's ano siya talaga, highly recommended for patients with TMJ problem or yung mga myofunctional problems. So for cases naman like full mouth reconstruction, sometimes it's always case to case, no. We should incorporate Botox on that kind of treatment kasi hindi naman natin siya like predict the force of the muscle dito. So we have to make sure that we know the case, we study the case before we can give that to the patient. That's why it's always case-to-case basis.
Ano yung nilalagay niyo dyan, Dok? Ano yun?
Ice. Ito.
Ice.
Oo.
Para saan, Doc, Mark, yung ice?
Ilang millimeter yung ibabaon mo sa akin?
Wait, para saan mo na yung ice, Doc? Mark?
Para manam up yung area. Yan. Although we can place yung mga M-lock, pero ito parang gano'n rin yung effect.
Okay. Doc, Jonas, anong sabi mo? Ilang?
Ilang millimeter yung ibabaon mo sa
Bali
akin?
ito, gauge 30 to na na needle. So kapag intramuscular kasi yung injection natin dito, so medyo lalagpas tayo dun sa half ng needle.
Ha?
Yan. Pag intradermal, mas 1/3 yung ano.
Grabe naman yung half, Doc.
Okay.
Intramuscular.
Titirahin mo ba yung ano ko, yung boto ko?
Hindi.
Hindi naman.
Kapag may tinamaang bone, medyo magre-retract ka.
So, si Doc Mark, ano yan? Surgeon yan, oral surgeon. Pareho naman silang oral surgeon. So, trained yan. Na PGH trained. So, kaya Dr. Jonas trusts Doc Mark to do this procedure.
So, yung first na gagawin natin, i-reconstitute natin yung ano natin, yung botulinum toxoid na solution. Yan. So, we'll be using NSS. So, for 50 units, maglalagay tayo ng 1.25 NSS.
So usually for the botulinum toxin, it will last for like 4 to 6 months yung effect niya. Pero if you put if you relax the muscle kasi, 'di ba may mga fat pads. So yung side effect niya na nagiging lumiliit yung fat pads dito kasi lumiliit yung muscle. So hopefully.
Usually, you will see the effect after 3 to 7 days.
Mga supporters natin.
You'll just put the needle, tapos dapat it would go down without you pushing the syringe downward, no? So, para malaman natin kung fresh yung yung solution. So, okay.
Fresh.
Oh, fresh! Nga! Fresh na fresh.
Just do a figure of 8 movement. So, hindi mo siya i-shake. So, ano lang, parang gentle mixing. Okay. Tapos, yan. Usually, you create a line from the tragus of the ear towards the corner of the mouth. Straight line yan. Tapos, you create vertical line from the ear. Tsaka dun sa parang notch. The curve of the masseter. So, that's the safe zone. So, you create a circle on that area. So, you can put 3 dots dun sa circle na yun. So, that's where the area we will put the solution. So, Botox is usually reversible yung effect niya. So, it would take around 4 to 6 months for it to have its effect. So, after beyond that, siyempre, the muscle would regain its original state niya. Muna ng ice. So, 25 units ilalagay natin on that side. So, divide natin yan into 3. So, 25.
Nariting ko na. Walang pain. Hindi ko nagko-contract yung muscle ko. Relax na siya. Hindi na ako makakain ng steak.
Side.
I love it. Hindi ko...
So that's it for the right side.
The right side. How does it feel? Yeah.
Now we're gonna do the same thing on the right side. So we'll do a marker and the 3 dots for the deposition of the solution. So for tonight, you will not wash your face muna. So leave mo muna until tomorrow. Yeah.
Pwede nga hanggang next week eh.
How about, Doc, for the physical activities, kailan pwede mag-start ang
For
patient?
the physical activities, siguro avoid anything that would yung tatamaan yung area kung saan nilagyan natin ang solution.
Okay,
Pero example, pwedeng mag-exercise right away,
Ay,
pero hindi tatamaan yung area.
okay.
So physical activities are allowed as long as hindi matouch yung area.
Okay, thank you, Dr. Mark, for this procedure. Actually, I haven't felt anything. Hindi siya masakit. The insertion itself, hindi. Dr. Mark used 30 gauge needle, and when you do it extra-orally dito sa face, hindi mo masyado mafe-feel doon. Tapos nagbaon na ng konting needle, which is, for me, 1 to 10, halos mga 1 to 10 yung pain.
10 is the highest.
10 is the highest. Siguro nasa 1 lang. Halos hindi ko na-feel yung insertion itself. Because, we have thicker skin dito sa labas. And it's completely safe. And yun, medyo kanina, of course, it's my first time. So medyo may na-feel akong parang konting kaba. Pero mabilis lang. So it's actually a few minutes procedure wherein you don't need to do anything. Sobrang chill. Napag-isipan namin, let's do Botox. Let's go Botox. And later, I'm gonna have my workout. So chill lang kami. As long as, syempre, hindi ka lang magpapatama doon sa area na yun. And any strenuous activity are allowed naman because it's intramuscular and it's like an additive. But ang pinaka-point natin dito is that we will going to relieve the pain, the tension of my muscle para at least mas quality yung life natin. So again, thank you Dr. Mark for your service. Grabe. So yeah, chill.
So Doc Jonas, what if the patient is hungry after the procedure? Pwede bang kumain right away? Paano yung in terms of eating?
Okay, so Botox is a non-invasive procedure. You can eat after, you can do whatever you want after. Wala naman masyadong mga post-op na serious activities, just like not as comparable with surgery or something. Pwede, you can eat, you can drink right away. And it's as if it's normal. Pero syempre you have to avoid touching it muna. Because we are dealing with muscles, so wag lang muna touch. So if you have any other questions, just message us.
Five minutes later.
So actually wala pang 5 minutes after procedure, nagutom si Doc, kumakain siya right now. Feels normal, Doc?
Usually, mga 3 to 7 days so mag-feel it.
Okay.
Yeah, chill lang.
Mukbang.